Having nerve pain is no joke. It can be a life-interrupting issue. It shows up in your hands and your feet, and it can progress until you absolutely have no feeling whatsoever. Joining us now to help, we welcome Dr. Christina Captain from the Sarasota Center for Acupuncture and Nutrition. Dr. Captain, we're so happy that you're here. You are here today to help us. So, what's causing this pain?
So first of all, peripheral neuropathy, nerve pain, is affecting 13.5% of Americans.
Wow.
Is that amazing? 20 to 30 million people that are living in the United States have some form of peripheral neuropathy. So, and there are about 100 different types. We're going to really focus in on the types that affect the distal portions, meaning the far away portions, our fingers and our toes, our hands and our feet. And it pretty much is a pain and loss of sensation. So what causes it? What causes it for the most part is diabetes, especially an out of control diabetes, one that maybe it hasn't been diagnosed, or one that is just poorly controlled, not getting that A1C down into a reasonable range. But other things too, trauma, surgeries, chemotherapy can cause peripheral neuropathy, cardiovascular issues where we're not getting blood flow to the extremities, either due to plaquing or inflammation. So even alcoholism can cause, and nutritional deficiencies, vitamin deficiencies. So all of that can cause peripheral neuropathy.
How does it feel?
Well, you know, it's an interesting thing. You can either have significant pain, where you just have pain. It can be either your feet or hands, and we're just going to talk about that today pretty much. Or it can be pretty much, actually, it can be in your torso too. But it feels like pain, or it can feel like numbness and tingling, or it can feel like wet paint, like you're walking on wet paint or water. It can feel like you're stepping on clouds or pillows, or tightness like a sock or heavy band is around them. Yeah, all of those.
Wow, it seems like it really will affect your life.
It can, and the thing of it is, as it progresses, you might not notice it. It's kind of like, you know that whole story about the frog in the boiling water?
Yes.
And you just turn the heat up slowly, slowly, and it never knows until it croaks finally, right? Right. Okay, so it's kind of like that. You get a little bit of a sensation, a little bit of loss, and it just aggregates until it's finally like, wait a minute, I can't feel this anymore. And that becomes really life-altering. So for example, think about driving. You know, you have to be able to feel your feet to move your foot from the brake and the gas pedal, and those signals have to go from your feet and your hands to your head, to your brain, so that you can react appropriately. Well, when that starts to deteriorate and you start to lose your sensation, you can't have that reflex anymore, so it's very dangerous to drive, and people pretty much lose their freedom in that way. And even holding a wine glass or playing pickleball or writing. A lot of these things become really difficult when you cannot feel. And that everyday loss of freedom, that sensation that you're not going to be able to enjoy life anymore, that's where we really get into trouble.
How can you help?
Yeah, so what we do is patients come into us and they are tested. We put them through a test to find out what type of peripheral neuropathy they might have and if they need a referral out to neurology or something like that. Most of these people have already been to primary care and neurology. They come to us for, how can you help me? Because they don't want to take a drug or they don't want to do some other procedure, which there really isn't too much except for medications to use. So we do a test, we find out how much loss there is, and then I give them best recommendations. Now, the greater the loss, the more doses of acupuncture you're going to need to have. We treat with acupuncture, laser, biofrequency, and we look at lab analysis, blood tests, to make sure that your nutrients are all fulfilled. You have enough vitamins so that your nerves are happy and healthy. Now, once we know how many doses you need, then we give the plan. And it is not a, you know, one-shot deal or 5 sessions and my neuropathy is gone. It's not like that. It took a long time to get here. Now, the easiest one to fix is if you do have a vitamin deficiency. So let's say B12 is at the heart of and a lot of the B vitamins are at the heart of neuropathies, especially peripheral neuropathy. When you take metformin for diabetes, you can see how this little pattern is occurring now. You have diabetes, you're taking metformin, very popular drug, right? But metformin has a side effect of taking B12 right out of the body.
Oh,
so, right? I know. Whoa,
great.
So now B12 is gone, and now we start to get sort of maybe some B12 deficiency neuropathy. Well, that's the easiest one to fix. You have a B12 deficiency, we're going to give you some B12, and voila, you are going to feel better and gain some sensation. Now, if it's not that, if it was trauma or if it was nerve damage because blood flow hasn't gotten to your feet and your hands, or it was chemotherapy, there's all different techniques that we have to help you figure this out. But again, it takes a lot of doses. We're not talking 5 or 10. We're talking a lot more, like 10, 30, 20, 30, 40 sessions to be able to regain, or in the best thing is to not let it progress. So if you come and you're worried because this is getting worse, that's where we come in. We can help you with that.
Oh, it's so good to know that you can help.
Yeah.
Thank you so much. We need to get out to you and get you to start us out on the right foot. And you can learn more at scansrq.com.